Have you guys heard the debate on what an ER pharmacist does by Scott Weingart from MCRIT? What's up, you guys? Do ER Pharmacist, Little Pharma. I just got off a flight, and so I was listening to all sorts of podcasts, one of them being the debate between Scott Weingart and Megan Rech on what an ER pharmacist does and what we should be doing and how we should be utilized in the emergency department. So I think this is really interesting, obviously from the perspective of an emergency medicine pharmacist, but also I think other clinicians with any inpatient service that has pharmacists should be very interested in this, and obviously from the pharmacist perspective, but also from the perspective of the other team members as well. So my thoughts on this, so basically Weingart is saying that we are kind of duplicative work and that we're de-skilling some of our other professions within the emergency department, like nursing and physicians. So we're just drawing up meds, nurses can draw up meds, we're making clinical decisions, physicians can make clinical decisions. And so while this may be true to some degree, I think that this is really a call to not only ER pharmacists to advocate for yourself, but for physicians to understand what your ER pharmacists are capable of. My stance is that ER physicians should be offloading a lot of their cognitive workload onto their ER pharmacists and using them to the highest potential at the top of their license. So for example, you go in, diagnose a patient with a serious infection, and you come to your ER pharmacist and you say, hey, this is the diagnosis. Will you please order antibiotics that are appropriate at the appropriate dose given their previous cultures, yada, yada. And your pharmacist should be able to do that. You should trust your ER pharmacist to put in the correct antibiotic orders and not look at that patient again. I think you should be able to be in a critical situation and look to your ER pharmacist to be like, is there any medications that could have caused this? Are there any medications that we can give that we haven't thought of? So use them as part of your clinical decision making rather than saying, I need 100 milligrams of succinylcholine and 20 milligrams of etomidate. Like, they know that. They know how to dose those medications. So even if you are giving them orders for what medications to give them some of the cognitive workload, offload that from yourself. And Weingart's argument to that is that we are de-skilling the physician so that if they go somewhere else without an ER pharmacist, they're not going to know what the doses are because they haven't been doing it and they haven't been practicing it. I don't know that that's true. I think there's all sorts of arguments we can make against that. Like, nurses put in most of the IVs. It's not that doctors don't know how to do it anymore. Like, if a nurse isn't around, a doctor can put in an IV. If an RT isn't around, we can give a nebulizer. So I thought this podcast was really interesting, and I think you should all go listen to it. But especially if you're an ER pharmacist, I think it is really important that we advocate for ourselves and create a role for ourselves within the healthcare team that is unique to us, rather than just being like a consult service that we could, take it or leave it. So that's my 2 cents from that podcast. Comment with your thoughts below, or if you've listened to the podcast, let me know what you think. Bye.